So I did my project this week on how lithium is a mineral that can be used to prevent Alzheimer's disease. So an explanation of Alzheimer's disease. So Alzheimer's is a tragic neurological malady characterized by a progressive and irreplaceable shrinking of brain tissue, and this results in a devastating decline in memory, social abilities, and communication skills, which all eventually leads to death. And more commonly, this is a result of a complex combination of genetics, lifestyle, and environmental factors over a whole lifetime, which is why most patients don't present with symptoms until over the age of 65. And Alzheimer's is a result of two trademark injuries that occur at the cellular level. So the first one is plaques, and plaques are deposits of small protein fragments called amyloid B or beta amyloid peptides. And when these clump together, they block normal cell-to-cell communication. But this paper focuses on tangles. So tangles are a result from a disruption in the production of the tau protein, and the tau protein is used to help circulate nutrients throughout the cell. So lithium has been used to heal ailments as wide-ranging as asthma, gout, cancer, and migraines. And when scientists saw that lithium was resulting in lower rates of cognitive decline in bipolar patients, they became very interested in using it for neurodegenerative diseases. And the first thing they did was they used lithium for patients who were already suffering from Alzheimer's. And the results were very disappointing because the damages to the brain were too great to turn around. So the lithium would not be able to reverse the effects of the Alzheimer's. So the next step they did was they turned to 45 participants with mild cognitive impairment, which is a precursor to Alzheimer's disease, and they provided a subtherapeutic level of lithium, which is low-dose lithium, over the course of 12 months. And through this, it was found that those in the lithium group had a decreased presence of the destructive tau protein, which results in the tangles, as I talked about earlier. So in conclusion, there are very few solutions that have been discovered for preventing, treating, and reversing associated cognitive decline, especially with Alzheimer's disease. And when started early, low-dose lithium may be the key intervention to prevent this cognitive decline. And this is the paper I used.